Specialist for the Utah State Board of Education. And today we're going to discuss the Healthcare Teams Pilot Grant. And this is the technical assistance webinar for that grant. With me today in the audience is Kina Morandi. She's our Executive Secretary at the Utah State Board of Education. And also Betty Sue Hinkson, who works for the Utah Department of Health as a school nurse, state school nurse consultant. Let's go ahead and get started. So this grant program is the Utah State Board of Education. They're offering this competitive grant funding to any Utah school nurse who leads a healthcare team and that provides student-centered care using a multi-tiered approach. So this was taken right from the application. So it's nothing new. As far as this webinar, we will be recording it. So it will be on our website after. And it's also located where the application is located. So the length of this pilot project is very short. It's actually just the rest of this school year. So 2021 to 2022 school year. The grant funding is totaling $28,000. That's for the entire state of Utah. And that'll be $7,000 per school nurse per school that they choose. So the funding actually goes to the nurse minus the unrestricted cost rate. We'll be talking more about that in a moment. So we'll be choosing up to 4 nurses to pilot this program. And so we can collect data and learn from it and grow from it. The awarded funds that will be used for the school nurse, the awarded funds, like I said, they'll basically be a school nurse stipend. So the school nurse will receive a majority of these funds. So that's exciting news for our school nurses because they'll be putting this extra work in. I know how busy our Utah school nurses are, just like the rest of the country. And so hopefully this is an incentive enough to apply for the grant and to be able to manage the grant and manage the project. So who can apply for this grant? So it's any LEA in the state of Utah that contracts or employs school nurses. So school districts can apply and charter schools. And I wanted to make a note and make sure everyone understands that the school nurse does not need to be a supervisor or in a lead school nurse position to apply for this grant. They do, however, need the help of the LEA. And the reason is you're going to need their support for receiving the funding. They're going to need the signatures of the superintendent and the business administrator. And so it's important that you work as an LEA to apply for this grant. So each LEA will be able to apply for up to two school nurses / schools for this project. And we'll talk more about the funding in a moment. Well, I'm just kidding. We'll talk more about it right now. Okay, so the funds awarded are going to be used as compensation. And again, that's for up to 2 team leads per LEA. And the team leads need to be school nurses. And that's $7,000 per team lead, up to $14,000 total for each LEA. So to oversee the implementation of the healthcare team in the schools, that's what the money's for. The LEAs, they must deduct the unrestricted cost rate, indirect cost rate from the $7,000 per school nurse per school. So there won't be money in addition to the $7,000 for that to cover that indirect, unrestricted indirect cost rate. The funds awarded will be paid to the LEA during the healthcare teams pilot program. And the way that we have this set up, it's explained in the application, but we'll talk a little bit more about it right now, is that 50% of the funds will be sent out to the LEAs once the progress report is submitted. And that's due on January 31st of 2022. That's it. So it's not very long away. But basically the progress report is going to show, just tell us kind of where you are in the process. We're hoping that as soon as we announce the winners, they'll be able to just get started on their project. So the thinking of it, sort of the planning, that should be done by the time that we send that out, that award letter. And then the remaining funds will be paid after the final school health workload report and the end of contract report that are submitted by the LEA, and that's due June 30th of 2022. So as a lot of the schools will already know, the school health workload report is the same report that schools will be they submit this year after year for the school appropriations grant. So that report's not any different. It's just going to make sure that you turn that in, because we use the data we receive from that for planning, and also it'll be used for this grant as well. So it's important that both reports in June are received. And so schools that don't submit a school health workload report, this will be a little new for you, and there will be a little bit more work on your part if you are selected for the grant. So the required accountability reports are those reports I just mentioned. So each report is due, the progress report will be due January 31st, 2022, and that is for the activity period of July 1st through January 15th of 2022. So the reason we picked a date that's before is some schools are already providing a project. They're already doing this. And so, you know, depending on the school and depending on the situation and the circumstance for the LEA, they might be able to include data that was already part of from July 1st on. Other schools won't have that. They won't have the same situation, and they'll maybe just report data from December on, from when the award letters are sent out. The school health workload report, again, that's no different than any other year. That's going to be due June 30th, and that's for the full 2021-2022 school year. And then the end of contract report, that is specifically for activity from January 16th through June 15th of 2022, and that report will be due June 30th. So this framework for the 21st century school nursing practice, I'm including it for information only. It's not part of the grant. However, a lot of projects that school nurses choose will be able to fall into the framework for the 21st century school nursing practice. This framework was created by the National Association of School Nurses, but it does fit nicely with projects that the LEAs choose to implement. Care coordination, you know, this is something that the project really calls for. A lot of times, as the application states, school nurses do work in silos. They're the only healthcare professional in the schools. This will sort of, this project, we're hoping that school nurses especially can sort of bridge those gaps and sort of make connections and work together as a team to sort of to meet these goals, whatever the school's goals are. The leadership, nurses they're advocates for students. They're in a leadership position naturally, and this will sort of enhance that. Quality improvement, quality improvement, all school nurses should be doing this in their practice. And you can even, you choose that as a project, a quality improvement project, and sort of, extend that and show us the data from that. So there's a lot of options on choices and what the schools choose to do for this project. And so we're looking for not only creativity with your ideas, but also feasibility. Is it going to be able to be done or completed by the end of the school year? And I know that's very difficult, and that's why we're trying to get this done. We're trying to get it out. We want to select a few schools and start this process for you. Community and public health. Sometimes with the projects, you can choose the entire school as a population, maybe if you're looking at absences, or you can choose a select few, maybe students with a health condition or students, with medication. So, but community and public health, nurses are, especially school nurses, are very familiar with providing public health. we've been doing it. We're really good at it. And so this will give you the opportunity, especially for your projects, to choose something for the school community. And it's based on school need. So your school needs are definitely going to be different than maybe someone's in a different part of the state. So that's something to consider as well. What are your school needs when you're deciding this project? And then the standards of practice, we always want to work within the standards of practice. Nurses have specialized knowledge. They're trained to lead, and so we want to just enhance that and make sure that all the rules are being followed. That nurses are aware of. So the healthcare teams, let's talk a tiny bit about that. So your healthcare teams, they're a type of multidisciplinary team. This description is also given in the application, so it's nothing new. But it's basically a team in the school setting that's going to use strategies, and they're going to combine their efforts to collaborate and coordinate student healthcare needs through a process that achieves mutual goals of the team. So the goals that you put down in the application are going to be team goals. They're not going to be just individual goals. They're going to be more of the grant goals. So what you're looking to achieve as a team. The parents and the student should be part of the team. However, depending on what you choose to pilot or what you choose as your project, that might not be feasible. So if you're just counting absences, you could use students as part of the team, but in that situation, it's more of a targeted population and not so much an individualized population. However, if you're choosing individualized goals, or if you're choosing to work with asthmatics, then you would want the parents and the student to be part of the team. And the reason for that is students especially are going to be more involved. You're going to accomplish more interventions if they're on board with it, and also the parents. And then healthcare providers, they may also be part of the team. And let's talk a little bit more about that. So school nurses, we have to be concerned with both HIPAA and FERPA. So I want to sort of review that. And what that covers is basically, it covers privacy for the students. And the school nurses, they should be knowledgeable and follow the Utah Nurse Practice Act and all state regulations. So ensuring also that the stakeholders and team members that are working within their scope of practice while protecting student privacy. So we don't want to jeopardize anyone's privacy. However, school nurses do have a little bit more leeway when it comes to discussing private personal health information. So most schools are not HIPAA covered entities, but they're instead covered by FERPA. And most people know what FERPA is, and FERPA is only for those school employees that have a need to know. So if your lunch manager, school lunch manager, is a part of your healthcare team, and they need to know, what they're looking for, they need to know more information, then under FERPA, they are allowed to participate and know that information. And then HIPAA, the privacy rule, it covers healthcare providers to disclose personal health information about students, and they can actually disclose that to school nurses, other physicians, or health-related providers for several purposes. And that's without the authorization of the student or the student's parent. But that doesn't always mean they're going to share information. So that might be a sticky situation. We've had school nurses say sometimes in rural areas, the communication isn't good. So I want to encourage all school nurses to sort of bridge that gap, to sort of reach out, make those connections, those working relationships, so that we can improve communication, which will, in the end, improve outcomes for all of our students. So the grant application timeline, just so you have an idea of sort of what we're looking for. November 22nd, as stated in the application, and the email I sent out, is the due date and that's when the grant application closes. So you'll have till 5 p.m. that afternoon My recommendation is that you start the planning process early. However, if you did download the application already and start it, I just wanted you to know that after 9 a.m. we did make some changes to the application to sort of clarify some things on there. It won't make a difference if you turn in one that you completed yesterday, but I'm just letting you know there's some clarification items on there now. So if you were to download it now, it would be a little bit different than yesterday. So the week of the 25th, so the Monday after the application closes, we are going to start reviewing all the grant applications, and we're going to approve and choose up to 4 school nurses or schools in an LEA to receive that funding award. The week of December 6th, it could be sooner, but I'm giving us a little extra time just because of the holiday. The grant reviewers will make their decision, and the unofficial award notice or denial will be sent via email to all participants. So if you've applied, but maybe you weren't selected or your LEA was not selected, we will still be notifying you at the same time. So you don't have to wait extra wondering and having to call. I realize that this is going to decide your future practice, and also if you're going to continue with the project. So we want to let you know as soon as we know, and we will do that. And then following that, an official award letter will be sent from the Utah Grants Management System. And that'll be a little bit after, once we get the chosen or the selected LEAs in the system, they'll receive an official award letter. The application can be found on the Utah State Board of Education Safe and Healthy Schools website. Here's a link to it here. And also it's on the right-hand side under the grant opportunities. There's a right-hand menu on the right side of the screen once you're in there, and that's where you can choose the Healthcare Teams Pilot Program grant and apply for it. We will also be posting this technical webinar to that website. So if you'd like to review it again, or maybe someone that's on the team or helping you fill out the application, if they want to review it, then it'll be on there as well in a few days. So now we are going to allow any questions just for what I just presented. We are going to go into detail a little bit more about the actual application. So if they're actual application questions, we just ask that you hold off for a moment. But if it's about anything I've mentioned so far, feel free to ask and put that in the chat, and Tina will ask me.
There is one question from Claudia. To be clear, are you thinking that this will be the healthcare team working with one student to improve health and academic outcomes? One student, or are you thinking a group of students? I think it's your question.
So it could be both. We are really leaving the ideas up to the schools, and we're going to look at feasibility and at that point decide. That's just part of the application process. It could be either. You could work with students. It could be a way of, from now on, you're going to all work for students together. So it'll be a bunch of different healthcare teams, or you can do a group of students in the school, but you are going to select one school, and with that school, you'll decide the school's needs. And that's going to be different than any other school in the state. It could possibly be the same, but it could also be very different. And from after determining the school's needs, that's when you'll come together with your healthcare team or decide what you want that project or that pilot program to look like. But we are leaving it up to the schools to decide that. We're not going to decide for you. It could be both, though. Depending on your ideas. We don't want to limit your ideas by saying it has to be one or the other. And so just, if you have an idea of what you want to improve or what you want to work on for healthcare, then for students, then I just want to encourage you to do that.
I don't see any other questions yet.
So feel free to ask questions. We are going to just go over the application though, just to save time for everyone. If I can figure this out, let's see here. Got it. Okay, here we go. So we're going to talk about the actual application. So this grant is called the Healthcare Teams Pilot Program Grant. You might see it as a big long initial, this HCT-PPG. It's going to be referred to as both, but just know that that is sort of what we're calling it, is the Healthcare Teams Pilot Program Grant, but we might be using this long little list of things to describe it as well. So the first part of the application really just describes the purpose of it. It talks about school nurses, how they do this anyway. They're already leaders, they're already leading healthcare teams. But this is to sort of formalize that process based on the needs of the school that the school nurse chooses, or the LEA chooses with the school nurse. And so we want to also just remind you that the multidisciplinary team can be made up of people around the school. It can be made up of stakeholders inside and outside the school. It's just basically whatever team for healthcare that is needed to accomplish the team's goals, the healthcare team's goals. We also want to emphasize that whatever project you choose, we want the health needs to be addressed by providing student-centered care. So what that means is basically it's student-centered, so it's based on their needs, but it's based on the students' needs, not just the population of the schools. So you might have healthcare professionals or individuals that can impact that student's health. And so we want them to be involved on the team as well. Of course, you know, being careful to protect their personal health information, but we kind of went over that, and we want you to follow the rules of that. But at the same time, we want to help that student however they need to be helped. So using the healthcare team approach to do that. So as far as this other part talks about who's eligible to apply, I feel like we went over that pretty well. It does say that the school nurses must have a current registered nursing license with a minimum of 2 years experience as a school nurse. A part of that application, you're going to be providing your actual nursing license number, and that will be checked. So make sure it's accurate, that it's actually, you didn't transpose a number. And so we're able to look that up. That will help us to meet that requirement. As far as funding information, we've kind of gone over this a bunch of times. We're going to select the 2 LEAs to participate, but it's possible we'll select, you know, 4 LEAs, but only 1 nurse in each LEA. So the bottom line is each school nurse or each project, each school will receive the $7,000 over the course of the pilot program. But we're looking at quality and we're looking at feasibility. So it's very possible for LEA to have two project ideas. They use the same application to complete, to kind of demonstrate what they'd like to do. And we only choose one of them because maybe the other one we feel isn't feasible or it's not doable. So there is that variation. It doesn't necessarily mean we'll choose that we'll choose only 2. But it's possible we will just choose 2. And that could be for a charter school. So it really comes down to what's in the application. And we want to emphasize that it really does need to be completed. You'll be getting points for stuff as simple as contact information. So you want to make sure everything is filled out and that you looked at it twice and what we asked for is the information you provided. And again, that kind of goes over the application due date. Any questions that you have about the actual application submission? So anything IT, please contact Tina Morandi. This is her email right here. And she works with me at USBE. She's on this call as well. She's going to be the best person to answer anything technical or computerized. I'm not the best person for that. I will be going to Tina if you ask me. And then if you want to ask me any questions about the actual application, did you mean this here? Did you mean that there? Myself, I'm available. And if you can't get a hold of me, you can reach out to Betty Sue and she will definitely give you the answer for that. And all our contact information is at the very end as well. And so these resources, you don't have to use them. Along with the 21st Century School Nursing Framework, I wanted to give you an opportunity to sort of get ideas of what you're going to use. So these resources are sort of, to help research your ideas as far as what you'd like to present in your application. And it gives you a lot of background on healthcare teams and how they can be used in the school especially. Okay, so the first section is section A, and it's the LEA overview. We will be giving 5 points, so please complete everything that is asked. So the name of the LEA would either be the charter school or the school district. So make sure that you are completing every box. We need to know the lead contact, the secondary point of contact, and also the business administrator. And if any information changes, I know that sometimes people change jobs. We need to make sure that that somebody is available. So we need you to reach out to us and the USBE team to update that information. So just be aware of that. Check your application frequently. Download a copy of it so you know if someone is out of date. We're not going to have any way to contact you, so please make sure that that is updated. And then the healthcare team leads. So this is information. It explains a little bit more. Again, make sure you fill out all the sections. So the name of the school nurse or the healthcare team lead, again, it's not the supervisor of the school nurse that's working on the project. It's whoever's going to be leading the healthcare team. So you might have a different, someone they call a lead in your school or your LEA, but we just want whoever's working on the project. And then that person's license number, their RN license number, their contact information. We want to know if they're part-time or full-time. And if you are part-time or you're full-time and it looks like you have a really big, heavy caseload, you might want to put in the application how you're going to overcome that, whether you're going to be working different hours or you have help with your other schools. So we're going to be looking at capacity of the school nurse and the healthcare team as well. So the next information is the total number of the schools that the school nurse is assigned to. So this is the school nurse's regular assignment. It's not anything to do with the project. Again, this is to determine capacity. We want to make sure that whoever takes on this project is going to be able to complete everything. And then the name of the school, of the lead that oversees the healthcare team. Again, that's the, I'm sorry, my dogs might bark, I apologize. So that again is the name of the lead that oversees the school. Then the next section is lead 2. So this is only if the LEA is applying for 2 separate school nurses and school. And again, it just repeats the same information. The school overview. So this gives us a little bit more information about the school that this is being chosen. We want the award is for 1 school nurse and 1 school. So out of the school nurse's assignment, the school nurse will have to choose just 1 school to focus on. And so you'll be looking at the needs of that school. So we'll want to know the name of that school again. And then also the total students attending that school, the total students with individualized healthcare plans for that school, and the total number of students who are prescribed medication while at that school that's been chosen. And then again, there's another option if applicable for school B.
Kendra, can I jump in for a second? So I just want to clarify, not everybody understands that LEA means the district. So you nurses that are in schools, when they ask who the LEA is, for example, it would be Granite would be your LEA, Alpine would be your LEA. And then down here where she's got school A and school B, that's where you would put your school. Don't put those up where asked for LEA, because we may have more than one school with the same name. Bonneville Elementary is a good example of that. There's several districts that have that. So make sure your LEA is your district. If you're a charter school, it'll be the same in both places, but a district, it'll be your district name for LEA and then your school name here.
So the next question in this section is to describe the target population. So again, at this point, you're focusing on each school. Only one school A if you're only applying for one school within the LEA, and then there's the option to explain the target population at a second school if more than one school nurse is going to be applying for the grant. So as far as describing the target population, we want to know why you've chosen that population, whether it's a group of students that have the same health issue, or you're looking at high absenteeism due to health, whatever the situation might be, or the reason you chose that school, we want to know why. It could be because they have more needs than your other schools, but this is where you sort of describe that. So why do they stick out compared to the other schools under the school nurse assignment? And so the school nurse or the LEA will sort of explain, and you can have two schools, it can be the same reason. Maybe you have two schools that are similar, but having school A and then school B, if you're applying for two different school nurses and healthcare teams, gives you the opportunity if two schools are different, and a lot of times they're going to be different. The next section is section D, and that's the healthcare team. So this gives a little bit more information about the multidisciplinary team, and it's actually a board rule, the term multidisciplinary team. We kind of went over it in the PowerPoint, but in the application, you can actually click on the link and it gives you the board rule that explains multidisciplinary team. So we're adapting that concept and that rule to include the healthcare team. Even though nurses aren't mentioned in there, it's not limited to only certain members that are limited in that rule. It could be other community members. It could be inside and outside the school. So that just gives a little bit better explanation of that. And then in question 1, this really gives the LEA an opportunity to explain the healthcare team members. And this absolutely will be different for everyone. And the healthcare team members mentioned here, they might change depending on the project. If you're doing a school project or you're choosing goals and outcomes for the entire population, you know, the healthcare team members, it might change, but we need to know basically who you plan to work with and that may change later. But we want to know right now, who do you plan to work with to accomplish the goals that you've set out to accomplish with the healthcare team. And then the question 2 is really the meat of it. It talks about the measurable goals, metrics, and outcomes. So we want to make sure that your goals, again, that they're measurable, that you are going to be able to meet them by the end of the school year, and that and we want to see outcomes that basically improve student health, or it increases maybe students being able to attend school because a health issue has been addressed, and through the multidisciplinary team. So we want you to consider how you're using the data to determine the interventions. This is where the planning part really comes in, talking to your healthcare team, talking, over the school's needs or the student population's needs. An example we give is only for school A, but you're allowed to do 1 to 3 goals per school. And again, this is to give you sort of, based on your LEA's needs, it gives you more of a leeway. You're not going to get marked down if you only have 1 goal, but if you do have 1 goal, make sure that you put that for school A, and you have 3 options, and then also school B if you're applying for 2 separate school nurses. If the goals are the same, you still want to put in school A and in school B what you're planning to do, and you can do up to 3 goals. We don't want it to get too hairy. There's not a lot of time. You might only have 1 goal, and like I said, you won't be marked down for that if it really encompasses what you're trying to accomplish. And then part B of this section in this question is to write a brief narrative explaining the measurable data element. So if you choose absences, and this is just a broad example. So if your measurable data element is absenteeism, then you're going to want to really explain the measurable data element and how that drives the implementation. So you're going to want to explain sort of the goal and how you're going to accomplish it and what you're looking to accomplish as well. And you want to, if it is basically on something, you want to include the baseline data in this explanation. We don't want a super long explanation. We just want to know where you are right now, where you plan to go with the goals, and why you've chosen that measurable data, how it's going to show you that you've accomplished your goals. And you'll be able to do that for both school A and school B. And again, if they're the same, you can just copy this section to this section if it's the same goals. And then part C is to write a brief narrative of how the qualifying personnel will increase access to health services. So including how access is improved for students who are underserved or at risk. And we want to know, basically in this question, first of all, if you're going to be targeting, if this is part of your target population, and also we want to know, we want to know what the struggles are for this population. Maybe it's a rural area, maybe it's finances, maybe it's, they don't have, the nurse is the only healthcare provider in the school, or there's only 1 mental health care provider. So it really is up to the school, but we want to know how this project is going to increase access to students in need. This next section is, it just kind of goes over the future reporting requirements. It talks about what reports are due again, and it also discusses the activity period and the deadline for each report. So the funding is not going to come until the reports are turned in. So you'll get 50% of the funding for the LEA after January 31st. And then you'll get the final payment, the other 50%, once the school health workload report has been turned in, and also the end of contract report has been turned in. So once those are turned in and you've completed them and you've not left anything out, that's when the funds will be released. We wanted to sort of give the selected LEAs an opportunity to receive part of the funding, because I know that the planning process for this is huge, and we're after the data. We know that that this is being done already out in schools, maybe not with the exact healthcare team, but we know that school nurses are collaborating and coordinating, and we want to know, basically, we want to see this on paper. We want to learn from it, and hopefully maybe in the future provide future funding for a project similar to this. This section down here, 1 through 9, gives you a little bit of ideas of what we're going to be asking on the progress report and the final report. The school health workload report usually stays pretty similar year after year. Once in a while, there'll be new changes depending on if we need new information. But Betty Sue is really good about giving you a heads up. Well, this is what we're looking for. And she's also already sent that health workload report out to LEAs that will be providing that information already for the school nurse appropriations grant. And so this is the budget breakdown. This is actually going to be a very simple budget. So the budget is dependent on whether the LEA is applying for one or two basically healthcare teams. So the healthcare team lead and the school that they'll be leading this over. And so you're either going to apply for 7,000 minus the unrestricted indirect cost rate, or you're going to be applying for two of them, which would be the 14,000. So for example, if in this section right here is the total requested amount. So that's the total amount before anything's taken out of it. And that's for the project time. So it'll be, say you apply for 2 schools and 2 school nurses to lead those healthcare teams, you'll put the 14,000 in here. The next section is the unrestricted indirect cost rate. Some LEAs don't have them. And so this is just really dependent on you. But this cost rate will be deducted from the requested amount. So it's important that you put in the cost rate and multiply it by either the 7,000 or the 14,000 and put that result right here, what that is. And then basically what you're going to do is subtract the requested amount, which is in this first box. You're going to deduct the unrestricted indirect cost rate from that amount, and that is this amount that the school nurse who's leading the healthcare team will actually receive. And it might be the full 7,000 for some school nurses. It might be minus that unrestricted indirect cost rate, and that's determined per LEA. And that's actually predetermined. That's not something that the LEA comes up with at the, just because. So that's to allow for those LEAs that have that amount already in there. Okay, so if you've noticed at the top of the application, each section has
Kendra?
how many points? Yes.
We have a question about what is the unrestricted indirect cost rate, and is that taxed? And I'm happy to somewhat explain that. So every year the districts negotiate their unrestricted and restricted indirect cost rates, and then once they come up with that, we have that percentage. The taxes part, your business administrator would probably be able to answer best, but there are 2 ways to get that unrestricted indirect cost rate. Your business administrator should know that, or you can contact me. I have every LEA, so I have every district and every charter schools percentage for that. But that is negotiated every year. I hope that answered your question.
And so this next section, you actually get 5 full points just for getting the authorization and the signatures in this section. It sort of gives you an idea. It talks about the schedule again in this top section, and then it gives us eventually you do all the signatures. So you're going to need the LEA program director. So that could be whoever's over student services, that could be whoever's over school nursing. That would be probably the signature. If it's in a charter school, it'll most likely be the principal of that school. But it depends really on the LEA for that section. The business administrator, hopefully you all know who your business administrator is for your LEA, your school district, or your charter. And then the superintendent That would be for school districts. We want to make sure that everyone's aware of these projects. We want transparency. We want to see teamwork, collaboration, coordination. And so we want to make sure that everyone's on board before they begin this project. Okay, and that is it. Do we have any other questions?
I don't see any, but Tina has put in the chat. Feel free to email her if you want her to send you your LEA's indirect, unrestricted, I forget what that means, unrestricted indirect cost rate for your district, and her email is in the chat. So check that if you want to find what that amount is. Email her.
And Kendra, just so those know, the superintendent signature for charter schools, that would be the director of the charter school.
Question, how many in the state will be able to be funded? And I believe that is 4 total, up to 2 per LEA.
Yeah.
Okay.
So it's 4 school nurses that will lead 4 school healthcare teams. But it could be one, even though an LEA applies for 2, it might just be choose one of those. And also it could be up to 2 per LEA. So just because someone fills it out for 2 doesn't mean that both projects will be approved. So it's really important, again, that, and I've stressed this many times, that the application is filled out. You have someone double check it to make sure what is asked is what you're putting in those boxes. And then also verifying any information that you put in there. So if it's the school nurse license, that you verified that and had someone else look at those numbers. Because what's going to happen is you're going to get points based on basically completeness. That's part of it. And if you put in a wrong number, like I said, and we're not able to look that up, then you're not going to get the points for that area. So it's important that you are complete, but also that your goals that you choose are doable and feasible for the nurses that are working in the schools and the healthcare team. So we don't want, if your goal is to work with the healthcare provider and the mental health provider, we kind of want to know how you're going to do that. But also we want to know what you're looking for this project, for the outcome of this project that'll affect student health. So I hope that gives you a brief overview of things. I look forward to seeing the applications, and I hope a lot of people apply. It's not a hard application to fill out at all. If you're on the fence about it, just think about most of this money will go directly to the healthcare team lead, which is the school nurse, and the school nurse will be coordinating and leading that healthcare team for this project. And so the rest will be volunteers. So we just ask that if you are interested, please apply. And if you have any questions in the meantime, I can give you questions about what's in the application. But like I said, Tina is the expert on anything technical. So if you're having issues, please contact Tina. And our information is also on the website. If you can't get a hold of us though, Betty Sue is a great resource. We all know that. And she's there for you too. And she'll be helping with this process as well.
One more follow-up question. So 14,000 for the whole state, and no, I believe that's 28,000 for the whole state, up to 4 awards. Each LEA may apply for up to 2. So one LEA may get 2 or the 14,000, or they may just get 1, depending on the scoring of the application, for a total of 4 awards that will go out. Correct? That's all the questions I see.
And good luck, and we look forward to seeing your applications.